Hello. This is me 4 days after having an open heart surgery. And as you see, I'm not great, but I'm doing my best. At this point, I didn't know what was happening perfectly. Obviously I was reassured that the surgery went well, but for me it will be weeks, months until I will get to know how much I got from that surgery. But still, there is no point in laying down if I can do something. So this is me doing some breathing exercises, and I will tell you everything about the breathing exercises and cardiovascular training that I was doing, hoping that the perspective of a physiotherapist, of someone who is experienced with physiotherapy, will help someone to prepare better, to have better expectations, and to recover better from the surgery. And obviously, I need to tell that in every video, I'm 30, I have no other health problems other than this heart issue. And my surgery was different than the surgery that you might have. And that is why the recovery is different for everyone. I will tell you what worked for me. But before you implement any exercise, consult that with your doctor or a physiotherapist, and always consider that every case is different. Something that I can do here may not work very well for you. So let's do it. I will tell you everything about the training that I could perform. So here I am doing some breathing exercises. What I have in my hand is so-called bulbulator, which is not a serious name. It has some proper professional name, but I don't know this one. And this is a very simple device, and there are plenty of jokes made about that, majority of which are concerned that this is just too easy, that this is just a toy. But reality is that in the first stages after the surgery, in those first few days, there is not really many things that you can do. So anything that challenges your breathing is really good enough. There are few ways how you can use this device. The first way, the first exercise is that you want to breathe out strongly enough to keep the first ball in the air as long as you can. The second exercise is about attempting to bring up as many balls as you can for as long as you can. The reality, the trick of this exercise is that the third ball is probably there just for the motivation, just for some certain goal to motivate you to the training. But I don't think it's possible to bring that up, or I don't know, maybe someone could do that. If you can, let me know. Actually, I have this device close to me. Let me check if 1 month after the surgery I can do it. So let's give it a try. Well, not a chance. The red ball didn't move up. So don't beat yourself up for not being able to bring all of them up. And regarding about the repetitions, about the number of sets, here as much as you can, as much as it's possible. At some point, I was stopping because I felt fatigue. I felt tired, and after I believe 6 or 7 days, when I was just about to leave the hospital, this exercise became so easy that I could do it in eternity. So I just stopped. I moved to more challenging exercises. Remember, your heart stopped for quite some time after the surgery. Your lungs were deflated. So any kind of exercise that uses them in full range of motion and challenges them is important, and you have to start somewhere. The second group of exercises are about the attempt to get as deep breath in and as deep breath out as it's possible. Due to the shortness of breath, after each breath I had to take a pause, which you will notice. And why these exercises are important? Because Breathing too fast is not very efficient because I remove carbon dioxide from my blood too quickly. This is a little bit of chemistry. Basically, the slower you breathe, the better. Below 16 breaths per minute, that's the goal. Now, this exercise has one more benefit. It is using your diaphragm in full range of motion, which is extremely important. It's like, imagine the situation after the shoulder surgery. If you will not try to move your shoulder in full range of motion, if you will not try to achieve that range of motion over time, then it's hard to imagine that it will recover well. That is why it's very important to use exercises that challenge diaphragm and chest in full range of motion. 4 seconds. Breath in, 4 seconds. Pause at the top, 4 seconds. Breath out, and 4 seconds. Hold at the bottom. How to mobilize the diaphragm in full range of motion? Place your hand at your belly button. Take a breath in a way to bring your belly button up, to inhale as much air to your abdomen, and keep it there. And when you breathe out, try to squeeze your belly button a little bit closer to your spine. In this video, you will notice that I will also attempt to breathe to the sides of my chest and to my sternum. Unfortunately, at that stage, it felt unstable to breathe into the end. So I do the same kind of breathing, but not fully. I don't want to provoke those sensations of instability. My sternum was cut in half, there are screws. It will take a lot of time for the bone to heal. I don't want to overstretch this place. So same exercise, but I don't breathe fully. To the abdomen, through the diaphragm, I breathe all the way to feel the very nice stretch. I will never be able to massage my heart or pericardium directly, but with those exercises I can move the fluids around to some extent. I can mobilize the tissues, mobilize the gliding of the tissues, and I can floss the nerve. The phrenic nerve that innervates the diaphragm is innervating the pericardium as well. So breathing through diaphragm in full range of motion also creates flossing of that nerve, which also was affected by the surgery. And the last group of exercises are the exercises that were shown by a physiotherapist just after the surgery, and these are basic breaths in and breaths out alongside movement of the arms. And basically on the 4th day, I think I was able to do 2 sets of 10 of each. Over time, I was able to get to 3 sets. But again, on the 6th day, I was very tired because of something that I will share with you in a moment. So I didn't do anything of that. I did just bulbulator and some diaphragmatic breathing. This one is mobilizing my body in a bit different way, which is also important. And now, few words about cardiovascular training. As I mentioned, there is no point in lifting weights. I know that you probably saw Arnold Schwarzenegger after open heart surgery doing delt raises with 1 or 2 kg just after the surgery. Don't do that. That's not a good deal. What will get you out of the hospital as quickly as possible is walking. The fastest, the sooner you will be able to convince doctor that you are able to walk quite a lot, quite smoothly without any help, the sooner they will let you go. Shortness of breath and fatigue will be the most limiting factor for you right now. You don't really need muscles at that stage. They will not disappear if you eat enough doses of proteins. Don't be scared about that. You should focus on solely walking, even stairs. You will get tired too quickly. You will do few rounds and then you will not be able to do anything for the rest of the day. It's better to split few rounds of walking throughout the day. You will notice a massive improvement day by day. On the 2nd day after the surgery, 48 hours, I was able to stand. On the 3rd day, I was able to do probably 2 or 3 corridors with some support. On the fourth day, I was able to do a few corridors without any assistance. And the beginnings are amazing. You think that you will recover very quickly, but I encourage you to treat this thing mathematically, which means that you add a few lengths of the corridors in the hospital, or add some length, some distance, but don't do it too much because you will make a mistake like me. On the fifth day, I was asked to go for the X-ray in the opposite side of the hospital, and I did that walk quite amazingly, and I was surprised how much I can do. So then I thought that, wow, I'm just stopping myself, I'm limiting myself, I should do much more. Then I do more than I had in plan, and the next 2 days were pretty weak. I felt much worse, and I am a physiotherapist. I saw a lot of injuries of muscles, of tendons, of ligaments, but the heart is different. And what I realized is that I don't feel fatigue of the heart immediately after the session, during the session. The fatigue of the heart appears later. If you sprain your ankle, if you tear your hamstring, you can move around that. You can put a kinesiology taping there. You can warm that up. You can move around the pain. With heart, if the heart gets tired, if the heart gets overloaded, it still has to work. So if you get tired too quickly, if you push yourself to the limit, you will have a really bad the next 2 days. And this video is done 1 month after the surgery. I already had 3 situations or 4 situations like that. It happens, and these are stupid mistakes, but please avoid them, learn from them, add only a little bit day by day. I know it's a massive strain for your patients, but take it easy, really. Nothing will run away, and be kind to yourself. Add a little bit each day. No worries, I promise you it will get better. It's getting better, and you will do yourself a massive favor if you will just add a bit. That's everything. This is what I did. These are my experiences a few days after the surgery. Hopefully it helps someone, and if you have any questions, just ask in the comments.